All right. Welcome, everybody, and thank you for joining us today to learn more about the power of knowing with Blue Cross North Carolina's All Copay plan designs. We are excited to expand this offering to fully insured and self insured employers with 51 or more employees, including balance funded employers, starting 1/1/25, to help make healthcare simple for you, your employees, and their families. I'm Cheryl George, and I will be your host for today's LinkedIn Live webinar. Just a quick note, today's session will be recorded, and you can access the recording later on by visiting this event page on the Blue Cross North Carolina LinkedIn channel. Should you have any questions during the webinar, please feel free to utilize the chat function on the right side of your screen. We do have some experts behind the scenes who will be answering your questions along the way, so don't hesitate to reach out. Without further ado, let's meet our presenters. First, you will hear from Renee Mills, Sales Manager, followed by Brittany Simpson, Strategic Client Consultant here at Blue Cross North Carolina. Renee has been with Blue Cross NC for 7 years. She has held positions in management in both new sales and retention and worked as an account executive on the new business sales team. With over 17 years of industry experience on both the agent and carrier side, she brings a high level of expertise and has a proven track record of exceeding both individual and team goals. Renee is dedicated to ensuring that each Blue Cross North Carolina member feels confident in their knowledge of their family's insurance coverage. Brittany has been with us for 9 years. She has spent the last 6 advising employers ranging from 1 to 500 employees and has an in-depth knowledge of all funding types, including fully insured, self-insured, and balanced funding. Brittany is passionate about developing and maintaining strong relationships centered on trust with each of her clients. She is skilled at developing the right benefit package for each of her clients and attributes her success to her ability to listen to customers and put their needs first. Thank you both for joining us here today.
Happy to be here.
Thank you for having us.
All right, Renee, we're going to start with you by kicking off today's agenda.
Thanks for that introduction, Cheryl. And thanks to each of you for joining us to learn more about All Copay plans. Here's what we'll be reviewing today. We'll start with why to choose Blue as your healthcare partner. Then we'll touch on the products and networks the All Copay plans are built on. We'll speak to why an All Copay plan might make sense for your business. And last, we'll review the available resources and where you can go for additional information. So with that, let's start with why to choose Blue as your healthcare partner. There are many reasons to choose Blue, but today I'll focus on 3. At Blue Cross of North Carolina, it's our mission to deliver smarter, better healthcare for you, your employees, and their families. And we do this by focusing on 3 things. 1, providing a simpler experience. 2, bringing access to higher quality care. And 3, making healthcare more affordable. This triple aim is our promise. And so you might ask, how are we doing? Well, we strive to provide our members and clients with an excellent experience through a plan that is easy, seamless, and dependable as possible. And the proof is in the numbers. In an annual survey of members and non-members, respondents rank Blue Cross of North Carolina number 1 in overall satisfaction, trust, and peace of mind, and they prefer us 6 times more than our competitors. And fun fact, 2/3 of survey respondents were actually non-members, which tells us that regardless of which card someone carries in their wallet, Blue Cross of North Carolina is still their preference. Employers say that they are most satisfied with cost, network strength, service, and our programs. This is why our customers stay with us year after year and why more Americans are insured with Blue. Second, access to quality care is key. We're here for all North Carolinians in every corner of the state, so our members can get the care they want, whether they are at home or traveling abroad. The strength of Blue shows in our provider relationships. And make no mistake, our relationships are strong and stable, which means greater access to care with less disruption for your employees. And these relationships are a critical part of offering lower cost and quality care options too. That's why providers consistently remain within our networks and why you get the best negotiated costs with them. Last, but certainly not least, affordability. It's no secret that healthcare costs are on the rise. At Blue Cross of North Carolina, we work to provide greater affordability to both you and your employees in terms of premiums and medical expenses that you pay. Managing healthcare costs is critical to providing the lowest cost of care. As stewards of your healthcare dollar, Blue Cross of North Carolina continues to focus on transforming healthcare through a total cost of care approach. By the end of 2024, we're expecting to reduce the nearly 9% projected medical cost inflation by 6 percentage points through our cost-saving medical and pharmacy solutions. These include pharmacy and formulary management, discounts achieved through network partners and value-based care arrangements, payment integrity services, which alone are generating a $42 per member per month savings, and condition care and case management through our nurse support program. So what does all of this mean for you? It means together, you plus Blue can offer your employees smarter, better healthcare now and into the future. Let's break down what all of this looks like. At Blue Cross of North Carolina, we have a massive national PPO network and a high-quality, high-performing provider network. And both are strengthened by our Blue Premier Value-Based Care Program and Blue Distinction Centers of Excellence for Specialty Care, all to provide the best options to help balance your company's needs between cost, quality, and access. Our health plan portfolio is built on these two networks, our Blue Options PPO with 97% of hospitals and 92% of providers in North Carolina, and our Blue High Performance Network, which is our quality-based EPO. Within each network, we have traditional plans, 1, 2, 3 plans, and of course, all copay plans. If you're not familiar with Blue HPN, it's a health plan that's built on our quality-based EPO network. This exclusive provider organization is designed to give you access to carefully selected providers and hospitals that are consistently delivering higher quality care at lower costs. Members receive in-network coverage from these providers, as well as receiving coverage for urgent and emergency care when they happen to be out of the network. We have strong anchor systems with Atrium Health, Duke Health, Iredell Health, and Fry Regional. Blue HPN is available across 28 counties, which includes York County in South Carolina, and coverage spans across more than 65 major U.S. markets. The smarter design of Blue HPN means lower costs. In North Carolina, savings are offered at 11% on average compared to our Blue Options PPO network, and up to 21% in some markets. And savings are not only seen in premiums, but also at point of service for the member. Now I'll turn it over to Brittany, who will expand on our all copay plans.
Thank you for that background, Renee. Now that we've reviewed how we're working hard to transform healthcare for all North Carolinians and the two available health plan networks, let's dig into the details of the All Copay plans. In this section, you'll see the advantages of the new All Copay plans. They're simple, easy, and transparent. To illustrate, let's start with a poll question. Please place your answer in the chat that best represents how you feel regarding this question. How confident do you think consumers are in understanding their out-of-pocket cost when receiving care? 1, not at all confident, 2, somewhat confident, or 3, very confident. I'll pause for just a few seconds while you place your answers in the chat. Not surprising, the majority of our responses are number 1, not at all confident. We've created the All Copay plan design to take the guesswork out of health insurance coverage and help your employees save money. As a reminder, these plans are currently available in our small group employer market, 1 to 50 fully insured. As of January 1st, 2025, we are launching this to our 51 plus fully insured, balanced funding, and self-insured employer groups. There are a range of plan design options, all have no in-network deductible and no coinsurance for services such as primary care provider, office specialist visits, outpatient surgeries, and emergency room visits, and the like. Members will only be responsible for the copay, which they will know in advance. Like our traditional copay plan designs, preventive care in-network is covered at no charge to the member. Let's take a look at an example plan design. Here we have an example of an all copay plan. Starting off with the chart on the left, you can see that members have a comprehensive list of services that they will know their copay amount in advance. The second column in this chart represents the range of copays that will apply based on the site of service, with the lowest copay in the primary care setting and the highest copay in the inpatient facility setting. We do have several plan designs with multiple out-of-pocket maxes, offering employers several options to fit the needs of their employee population. In the top right corner, you can see that an all copay medical plan must be paired with an all copay prescription drug plan. With different medical plan and drug plan options to select, you'll be sure to find a plan that meets your needs and your budget. It's also important to note that out-of-network benefits are subject to deductible and coinsurance and are consistent across all plans. As Renee mentioned, our all copay plans are available on both Blue Options and Blue High Performance Network. For our Blue Options PPO plans, out-of-network benefits are subject to deductible and coinsurance. Blue High Performance Network is an EPO product and does not have out-of-network coverage. There is 2 minor exceptions for urgent and emergency care. Members will also benefit from copay reductions when they receive care from a Blue Distinction Center of Excellence. These centers have been recognized for their expertise in delivering specialty care with proven results in quality, treatment, and overall outcomes. BDC designations are available for knee replacements, hip replacements, cardiac care, maternity care, bariatric surgery, and substance use disorder treatment. And like our traditional copay plans, there is no charge for the first 3 PCP visits when they visit the PCP that they have designated in the Blue Connect member portal. Let's take a closer look at the details of how our all copay plans work with a couple of member examples. In this first example, the member has a broken foot and visits an in-network orthopedic specialist. On the all copay plan, the member has a $30 copay for the specialist office visit. Since the office visit and the x-ray occur on the same date of service with the same provider, the member is only responsible for the additional durable medical equipment copay of $30. This brings the member's total out-of-pocket cost to $60 on the all copay plan. On the right, you can see with a traditional copay plan example, we are assuming the member has met their deductible but not their out-of-pocket maximum. In this scenario, the DME is subject to 20% coinsurance, so the member will be paying $56 for the brace and crutches and a $30 copay for the specialist office visit. That brings the member's responsibility to $86 on the traditional copay plan. Our next example is a member who has an in-network outpatient knee surgery, followed by 5 physical therapy visits. An outpatient hospital claim has 2 parts, the professional portion and the facility portion. On the all copay plan, the member is only charged for the facility portion of the claim. In this example, that is worth $1,500. The anesthesiologist and the DME both have an additional copay of $70 each. Then when the member is discharged from the hospital, they go to their 5 physical therapy visits, with each visit costing an additional $70 copay. That brings the total out-of-pocket cost for this member to $1,990 under the all copay design. Let's compare the same scenario on the traditional copay plan. We assume in this example that the member has met their deductible or has not yet met their deductible. In this example, the member's deductible is $3,500. After the member meets their deductible, the following services are subject to 20% coinsurance: outpatient professional, outpatient facility, and DME. In addition, they also have a $70 copay for the anesthesiologist. This totals $4,707. Then the member also, once discharged, has their 5 physical therapy visits, and each has a copay of $70. The total out-of-pocket cost in this example is $5,057. You can see here that from the 2 examples provided, the All Copay plan design will save members money. Let's take a look at a few resources available for more information. Here's just a sample of our materials available that showcase the features and benefits of our All Copay plans. We have an overview flyer, which details the All Copay plan design, how it works, and the core value it provides to both you, the employer, and your employees. We also have the What's New at Blue video, which provides the same details in a short 90-second video. This video is housed on our All Copay webpage, which includes a contact form to request additional information. We offer customizable open enrollment videos that you can also share with your employees to help communicate the value of an All Copay plan. And for our Blue Options and BlueHPN networks, we have employer brochures as well as member quick start guides for each. If you're interested in learning more or obtaining a quote, please visit our website listed here or contact your authorized Blue Cross NC representative. I'll turn it back over to Cheryl to close this out.
Awesome. Renee, Brittany, thank you both for joining us with all of that great information. We are going to continue answering questions for another couple minutes here in the chat. And of course, as Brittany just mentioned, if anything comes to mind after this session, please reach out to your authorized Blue Cross North Carolina representative to learn any more. As a reminder, we will be sending out, as a reminder, you can access the recording of this presentation here on this LinkedIn event page. So you're welcome to review it at any point. And on behalf of all of us here at Blue Cross, thanks for joining us, and we hope you have a great rest of your day.
Thank you for being here. Have a great afternoon.